right. We are live. Good morning, everyone. How are you? Did you have a good weekend? All right, so we are on week 3. There's only one more week of class after this week. So it is going very quickly. You're 3/4 of the way done. Does anybody have any questions before we get into the test scores? Any questions on anything? Am I going too fast for anybody? Is anybody lost? Okay. All right. So you over the weekend, you guys had chapters 5 and 6 for testing. You should have read the chapters, taking the tests on page 185 and 186, and then graded it. So when I call your name, if you can tell me how many you missed or your scores for pages 185 and 186. Ada, you missed one on both? Thank you. Zumarinda? So, yeah. So I'll come back to you next class, but you'll want to do these questions to get ready for the state exam. Okay. Elvira? 0 on 2. What are on chapter 5 and 6? 2. Okay. Thank you. Robin? Samantha? Janiyah? That's fine. Catherine? Very good. Jihu?
3 and 0.
Thank you. Paula?
1 and 1.
Thank you. Kaylee?
On chapter 5, I got 95 and I didn't get to chapter 6.
Okay, do you happen to have 3 and 4 for me?
On 3, I got 95 and 4, I got a 7.
Okay, all right. Brianna?
0 from both.
Thank you. Clara? Or I'm sorry, Kiara?
0 from both.
Thank you. Cheyenne? Tamika? Jody?
0 and 1.
Thank you. And Abigail? All right. So any questions on what you guys read? Chapter 5 was on dementia. You'll have a lot of dementia patients. So it's important to know how to work with dementia patients. We talk in this class a lot about consent, right? Patients have the right to make their own decisions. We're just there to help facilitate that. But we're not forcing anybody to do anything. That includes dementia patients. So I want to explain to you a little bit about what it's like to be a dementia patient. Okay? How many of you guys speak, let's say Russian? Anybody here speak Russian? Okay, if I took you out of your bed tonight and threw you into a strange place in Russia, and I locked the doors to keep you there, and you could not understand what anybody was saying, and you didn't know a single person, you couldn't communicate, and then I left the lights and the music on all the time. So it's constant stimulus. And then somebody comes in and starts taking off your clothes. How would you react? Oh, yeah, you're going to be terrified. Absolutely terrified. That is what it's like to be a dementia patient. When you go in and you are trying to undress a dementia patient or perform personal care, that is their reality. They do not understand what you're saying. They are constantly mentally stimulated with outside distractions. There's nobody that they know. It's not a place that they recognize. So when you go in and you start trying to take off their clothes, they're going to react negatively. And you would too, right? So we have to understand that when we're working with dementia patients, it's really important that we have consistency, that the staff is the same. That way the patient gets to know the staff and becomes comfortable with them. We also need to make sure that we're moving very slowly, that we lower our voice, that we provide a very calm environment, and we're not threatening in any manner to our patients. If we're very rough with them, they're going to assume that we do not have their best interests at heart. So it's important that we understand their mindset so that we can communicate effectively. Now, with dementia patients, we generally do not ask yes/no questions. We still want consent, but yes/no questions are not a good idea with dementia patients because they have no control. They will always revert to no because it's the only way that they can show any sort of control. So instead of a yes/no question, I might ask, hey, Carol, would you like foot care before lunch or after lunch? Or would you like to go to the TV room or the activity room? Not would you like to get out of your room? Does that make sense? Limited choice. Now, the other thing that I want you to understand when it comes to pretty much anybody in a long-term care setting is that a lot of times they don't feel needed, wanted, or part of their community. And that's our fault. We make them feel that way. I've got to go in and bathe Mr. Jones, or I've got to go in and feed Mrs. Hopkins. And we give off this aura, this attitude that they are things we have to do things to, that they're not a partner in their care. And they're going to react to that. Everybody needs to feel needed. Everybody needs to feel wanted. And everybody needs to feel respected in order to thrive in their setting. Does that make sense? So in your own home, you are needed and wanted and able to thrive because other people are depending on you and you depend on other people. And it's a very symbiotic relationship. If you went home tomorrow and nobody needed you for anything, you'd probably throw a party. Man, it's my week off, right? I don't have to cook. I don't have to clean. This is awesome. That's why I cruise, right? So we would all enjoy that because it's a small break. But we know at the end of the break, somebody is still going to need and want us. But what if when you went home tomorrow and nobody needed you, they never, ever, ever needed you again? And now you've got all day long and nothing to do. You're not cooking. You're not cleaning. You're not taking care of other people. You're not emotionally supporting your family members. You're not doing anything. You're just sitting, usually in front of a TV because we don't want to deal with you. You would probably feel like nobody cared. You're probably going to be depressed and withdrawn. Everybody needs to feel needed and wanted. So a lot of the activities that we do with our dementia patients are geared around helping them feel like they're part of the community, like folding washcloths or matching socks. This is a very good activity for elderly female dementia patients where this was part of their daily routine. And it helps connect them to those feelings of being needed and wanted. Does that make sense? A lot of times we forget that independence matters. If independence was not important to you, you would not have developed it when you were 3. Independence matters. And our job is not to make our patients dependent. It's to help our patients remain as independent as possible and support their care. Does that make sense? So we don't take over. We are just there to fill in their gaps. And when you understand that, your relationship with dementia patients becomes so much easier, so much better, because they'll see you as a partner rather than an adversary. So if you really want to work with dementia patients effectively, keep these principles in mind. Okay. All right. So let's see here. Good morning, Shelby. Good morning, Melissa. Good morning, Ronald and Marie. Happy Monday, indeed. And Melissa, I am working with an Alzheimer's patient now. Yeah, it takes a lot of, definitely takes a lot of patience and perseverance. So class is half over. Did you register for the test yet? If you have not registered for the test, you probably need to, because remember, the whole process takes 3 to 4 weeks. So if you're registering now for the test, you should be testing about a week or 2 after graduation, which is perfect timing. Long enough that you can practice, short enough that you don't forget what I say. I'm going to caution you, though. A lot of students don't register when I give you the registration forms. They think I'm going to do it after graduation, after I practice, when I feel a little more confident. So they wait until after graduation. And then it's, well, I haven't had time to go into practice, so I'm going to give myself another few weeks. And then it's, oh, my cell phone bill is due. I don't have the money. And then it's, well, Christmas is coming. I'll wait until after the beginning of the year. And you're constantly putting it off. And before you know it, you're back in my class a year later because you never took the test. That's a huge waste of money and time. I'm trying to protect you by encouraging you to register for the test. You guys are way, way more prepared than you think you are. I just had a group of 7. She messaged me on Friday or Saturday. It was a class of 7 students who took a like one of those weekend CNA courses and did not feel prepared. So she reached out to me and I told her about the live stream, and those 7 people went through and watched all 7 lessons, all 7 of the class live stream. They all tested on Friday. They all passed. You guys are way more prepared than you think you are. Register for the test. Go take it. You're fine. I promise. Okay. All right. Don't forget the game show. The game show will be on next week on week 4, Tuesday. And I'll go through 15 test-like questions and explain why the answer is the right answer. So it's a really good learning opportunity, but it's a great way to see the types of questions that you would see on the state exam. So remember that you have that available next week as well. So how do we know what to do with each patient? Care plan. And we follow the care plan, the whole care plan, and nothing but the care plan. That means we don't add to it. We don't take away from it. The care plan stands exactly how it is. What if we can't follow the care plan? What if the patient says no? Yeah, tell the nurse. Yeah, so we only do 2 things. We follow the care plan or we tell the nurse. While we're following the care plan, we should be making observations. Anything that looks or smells or feels or sounds funny should be reported to the nurse. This is half of our job. We're not just there to do the tasks. Remember, making the observations is what sets us apart from everybody else. That's why we have to be certified. So every skill starts with the opening. What does every opening start with? Absolutely. We're going to knock. And you have to do this for the test. You have to knock. It is the very first checkpoint on every single skill. Did the candidate knock? So when you're practicing, make sure that you're putting that step in. So every skill begins with the opening. Every opening begins with a knock. Once you go in to the patient's room, you're going to identify your patient by name. And you want to greet them as well. Good morning, good afternoon, hello, how are you? Be nice. After that, you're going to introduce yourself by name and title. Now, a word on this. You might have just walked out of that room 15 minutes ago. Does that mean that you still have to introduce yourself by name and title every time you walk in the room? Yes, you do. Even if you think they know you, because these patients are self-absorbed. They're in their head about what's going on with them. They're medicated. They're sleep deprived. Do not assume that they know who you are and what you are just because you've been in that room before. So we're going to introduce ourselves by name and title every single time. Then we're going to tell them what we're there to do. I'm here to do hand and nail care. I'm here to do foot care. I'm here to take your vital signs. I'm here to get you dressed. What are you there to do? After you explain what you're there to do, you're going to ask them, is that okay? Very important. We have to get consent from our patients. Just because they're in our setting doesn't give us the right to do anything we want to on them. We have to have their consent. If they say no, we report it to the nurse. Try to find out why nicely, but report it to the nurse. After you get consent, remember for the test, everybody will be pleasant, cooperative themselves. We're going to close the curtain and wash our hands. Only after you wash your hands can you touch those supplies. Only after you wash your hands can you touch those supplies. Okay. So in the online course, has anybody taken the online course yet? Have you gotten in there, looked at any of the lessons? I have sequencing activities for every single skill in the online course. And I go in and look at the reports quite often. Now, this course has probably about somewhere in the neighborhood of 12 to 1,300 users right now across the country. So there's 12 to 1,300 students right now taking that online course. And I go in and I look at the reports and see, and it amazes me in the sequencing how many students are gathering their supplies before they wash their hands. That is a common point that is missed. So be very careful. You cannot touch those supplies until you have clean hands. But once we have clean hands, then we need a clean place to put those supplies. But one of the supplies that we're going to figure out whether we need or not is gloves. So when we're gathering supplies, we have to think about gloves. So I'm going to use gloves if I'm going to touch any body fluids, personal skin, or non-intact skin. If I do decide to wear gloves, the first thing those gloves should touch is the patient. Be careful about contaminating those gloves before you use them on the patient. Once you've touched the patient, they are then contaminated, so you have to be careful about what else you're touching in the environment to prevent cross-contamination. And you've got to remove your gloves correctly. We're going to pull up at the cuff and take it off, and then go under and take it off. So when we decide whether we need gloves, and we don't wear gloves for everything, we only wear gloves when we need them, when these rules apply. But once we decide whether we need gloves or not, then we need a place to put all of our supplies. And we're going to go get a barrier. A barrier provides a clean area to put your clean supplies, and we always get it first. Remember, we don't touch our supplies until our hands are clean. So we do our opening, close the curtain, wash our hands, decide if we need gloves, get a barrier, and then get our supplies and put them on the barrier. Some skills are going to require that our patient is uncovered or undressed. Anytime the patient's uncovered or undressed, we've got to find a way of making them comfortable and not feel exposed. So we're going to use a privacy blanket for that. That privacy blanket is not just there for privacy, though. It's also there to keep our patient warm. Remember, healthcare environments are cold. Our patient is not fully dressed, and they're laying down. So it's there to keep them warm as much as provide privacy. When we put the blanket on, we put it on over the sheet and pull the sheet down underneath so the patient's never fully exposed. But when we put that blanket on, you don't want to snap it or shake it. To remove the blanket, we're going to remove the blanket at the end of the skill after all of our supplies have been cleaned and stored or put in dirty linen, and we removed our gloves. If you need linens, now we have a lot of linen skills, a lot of linen skills. If you need linens, there's a couple things we have to remember. Linens cannot touch your uniform. You can't hold those linens right up against you. Your uniform is not clean. You have to have clean hands to get the linens. We don't snap or shake anything. And if we're going to change something out that's under the patient, clean rolls toward me, dirty rolls away. Nothing goes on the floor, ever. Nothing goes on the floor, whether it's clean or dirty. Nothing goes on the floor but your patient's feet. That's it. And anything you take and don't use, you have to put into dirty linen. You can't just save it for later. If we have to turn our patient over in bed, they always must be in the middle of the bed. And you can't use side rails to keep our patients safe. Remember, side rails are restraint. They require a doctor's order. So if you decide to use them on the test, they don't count. It's like you can put them up, but it's like they aren't even there. Your patient must be in the middle of the bed at all times. So in order to do that, if your patient's laying on their back, we're going to scoot them toward us and then roll them away from us. So after the roll, they're in the middle of the bed. But remember, we always roll somebody away from us. We remain behind, the patient's behind. We have a lot of washing skills that we do. This is probably the biggest principle that you have to learn. There's a lot of steps here, and we have a lot of washing skills. So you're going to see this a lot. In fact, we have a couple today, or one today, I'm sorry. We have the biggest one today, actually. So anytime that we're going to wash something, we're going to get water. We're going to use paper towel to turn the faucet on and check the water temperature. It should feel warm, not hot, not cold, just warm. And we're going to ask our patient to check it as well. Don't add soap to your basin. Basins are no soap zones because adding soap to the basin means you can't rinse. And whatever we wash, we rinse. Whatever we rinse, we dry. We want to keep our surface dry. So a towel under the patient in bed, a barrier under the basin on a table or the floor. Anytime you put lotion on, you're going to warm it up and then put it on and wipe off the excess. So if we've had a basin that held water, remember, we don't put anything back in that, we don't put anything dirty back in the basin. So it's only held water. So anytime we have a basin, we have to look at how do we clean that basin after we use it. And for the test, super easy. You rinse it, you dry it, you store it. Super easy. But once you've rinsed it, we don't want our dirty hands or our dirty gloves to touch that basin once it's rinsed. So we're going to use a paper towel to pick the basin up, dry the inside, dry the outside, and then a paper towel for the drawer. That keeps that drawer clean. And then we have the closing. This is how we end every skill. We want to make sure the patient's in a clean environment because they rest better in a clean environment. We want to make sure they're safe, so that bed needs to be in the lowest position. We're going to address preferences. Do you want a magazine, head of the bed, that type of thing? They want to hear, are you comfortable? They need to hear that word, comfortable. And you're going to give them the call light, open the curtain, make sure the environment is clean, open the curtain, and then you can go clean your hands. If you have to document, you'll document after you wash your hands and then wash your hands again. So those are all the principles that we've learned so far. Any questions? Because we're going to use all those principles in what we're going to be learning today. Okay. We're also going to learn the last principle. Oh, thank you, Melissa, or Marie, I'm sorry. I've been a CNA for 2 years. I follow Miss Patty's videos, and it helped me pass the test. I learned a lot from them. Thank you. That's super sweet. All right. So we'll review the skills that we've gone over. We're over half done on the skills, guys, or we will be today. So everything that we're going to learn from this point, there's one more principle to learn, but most of everything that we learn from this point is going to be a repeat of something else that we've already learned. We're just going to reorganize the steps a little bit. So when we're taking a pulse, we always support the arm. Pulses are measured over 1 minute. The radial pulse is located at the top of the thumb side of the wrist, and we're going to use 2 fingers, not our thumb. Never use your thumb to take a pulse. The thumb goes on the back side. Normal pulse rate is between 60 and 100. This is a documentation skill. And remember, the patient needs to be comfortable for this. In Florida, you're going to count with 2 evaluators, and you have to say start when you start counting and stop when you stop counting, so those evaluators can start and stop at the same time and hopefully get the same number. But you can be off by 4 beats in either direction and still be accurate. We also learned how to dress a resident with a weak arm. And the way we remember this is USA first. Undress strong arm first. Privacy is going to be important, but it's not just the privacy blanket or the curtain that we're concerned about here. We want to make sure when we're dressing a resident that we go get their clothes before we undress them. And that helps with privacy. You don't want to strip somebody naked and then leave. That's a little uncomfortable. So we're going to ask the patient what they want to wear, gather the clothing, put it on a barrier first, and then we can start removing their clothing. We're going to lift from below with a flat palm supporting all joints as we lift. USA first, undress strong arm first, dress weak arm first. Don't overextend or force movements. We'll adjust the clothing for neatness and appearance. Make sure all the snaps lined up or the buttons. Make sure the pants are over the backside. Make sure the toe seam is along the toes, not forward and back. And then put the call light in the stronger hand. Hand and nail care. All we're trying to do here is keep the nails filed and shorter. If you do hand and nail care on a regular basis, you never have to trim the fingernails. So that you don't have to use clippers. Remember we talked last class about normal signs of aging and how hair and nail growth is going to slow. So if we're doing hand and nail care once a week, that'll keep your patient's nails at a manageable length without having to trim them. We're going to support the wrist and arm at all times. We'll soak the hand in water. Whatever we wash, we rinse. Whatever we rinse, we dry. We'll use an orange stick, the beveled edge, to clean under the nails, wiping it off in between each nail. And then we'll use the emery board in one direction only to file the rough edges. Apply lotion last by warming it up in your hands, applying it, and then wiping off that excess. Making an occupied bed. This just means we're changing the bottom sheet a half at a time. And we remember how to do this by clean rolls toward me, dirty rolls away. So get the patients on their side in the middle of the bed. So you've got less of a footprint. You got more bed to work with. Take the dirty sheet, remove it from the mattress, the corners, roll it toward the patient, put the clean sheet on, roll it toward you and tuck it under the dirty. Go to the other side of the bed and repeat the process. Super easy. Never let a patient lay on a bare mattress. That's the important part of this particular skill. Then we're going to put a top sheet on, change pillowcase. Make sure the sheet isn't touching the floor. Remember, nothing touches the floor. And dirty linens go directly into a hamper or a basket. They don't go on the floor at all. We want to remain behind the patients behind while we do this and smooth any wrinkles. Hospital corners, you do have to make them, but they don't have to be pretty. Just get the corners under the mattress. Side lying position, we've been over this a couple of times. It's all about proper positioning. We're going to scoot the patient toward us and then roll them away from us. But when we roll them, if they can't help, there's a certain way that you position their body to make it easier. Furthest arm up, closest arm over, closest knee bent, furthest knee angled. So up, over, bent, angled. Okay. Up, over, bent, angled. And if you do that, the patient rolls super easy. Then we'll put a pillow behind their back to keep them from rolling back onto their back. One between their legs, specifically between the knees and the ankles. Keep those bony areas from rubbing together. One under that top arm to get the arm in a neutral position. And then adjust the pillow under their head so it's not under the shoulder, it's under the head and neck. Call light goes on the lower hand. All right. Foot Foot care, just like hand and nail care, a little lower, no nails. So we're going to put the barrier on the floor, the basin on the barrier. All the washing rules apply. We're going to soak the foot, support it when you move it, soak the foot, take it out and put it on a towel to wash, put it back to rinse, take it out and put it on a towel to dry. And we're going to look at the foot while we do this. That's our whole purpose for being there, is looking at that foot. And we'll apply lotion to all areas except between the toes. We don't apply lotion between the toes. Put the sock and the shoe back on, clean up your work environment. That's foot care. Super easy. Mouth care, you know how to brush teeth. You're just brushing teeth. But because the patient's lying in bed, we have to think about some steps that we don't normally take. So you want to make sure the head of the bed is in the full upright position with the pillow behind their back, not their head. You want to protect their clothing with a towel while you're doing mouth care. We wet the toothbrush before we put toothpaste on it, and just a little toothpaste is all you need. We're going to brush all surfaces, allow them to rinse and spit as often as they need to, and then we're going to leave the mouth clean and dry. That's the step that a lot of people forget. They leave the patient sitting there with toothpaste dripping out of their mouth and all wet, and that's not comfortable. Respirations. We don't want to tell our patient that we're counting respirations because that's going to alter their breathing. We tell them that we're taking their vital signs. In and out counts as 1. Normal is between 12 and 20. And this is going to look like you're taking the pulse. You don't want to just stand over somebody and stare at them. Awkward. So you want to make this look like you're taking the pulse. You're going to say start and stop, just like you did with pulse. And this is documentation skills. So we document after the after we wash our hands, and then document again. Mugabe says, hello, Nurse Patty. Thank you so much for your CNA class. Last July and August, passed the written and skills exam. Huge love from Texas. Oh, thank you. Super sweet. So you guys are ready. You're ready. These are people from other states. They weren't even sitting in my classroom, and they passed. You guys are ready. Okay. Range of motion. We're going to do another range of motion today. Remember that CNAs do exercises to retain function, not regain, right? We're not trying to make anything better. We're just trying to keep what we got. So we're going to lift extremities with a flat palm from below, supporting at the joints. 2 points of support. We're going to move slowly and smoothly and all the way to the start position. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around. Any questions on what we've gone over so far? No? All right, let's get into today's lessons. Go to page 80. Ooh. You already know how to do this. We're just going to do it on a different body part. You know these principles. We follow the care plan. We do our opening. We evaluate if we need gloves. And remember, it's by the patient, not by the skill. So we evaluate if we need gloves. We're going to follow those range of motion steps, and we're going to do the closing. So the first thing that we need to know in order to do range of motion is, what does the care plan tell us to do? Now, I do have a video for this. We got a short version right here. Down here is test specific. Someone like you will be the patient. This is a live patient skill. All right, so nothing new to learn here. Let's take a look at the care plan. Care plan at the top, page 81, says provide the following range of motion exercise to the resident's right hip, knee, and ankle. So we're going to be working on the right hip, knee, and ankle. Are we doing the left too? What do you think? Are we doing the left hip? Why? Yeah, because care plan says. That's right, because the care plan says. So the exercise that we're doing here is flexion extension. And if you remember, flexion extension was up, down. So right hip, knee, and ankle, up, down. How many repetitions do we need to do? Well, the care plan will tell us that. This care plan tells us to do 3 repetitions of each exercise. And it tells us that the resident is not able to help with the exercises. Now, again, if you've got your book and you go down step by step these directions, if you just have your book in front of you and you follow these steps. So step 1 says read care plan. Step 2, and then it says knock. Remember, every skill starts with the opening. Every opening starts with a knock. Step 2 says greet resident, identify by name, and introduce self. Do you see those little numbers off to the side of each one of those? Do you guys see that? Those numbers correspond to the actual testing checklist that they're going to be grading you on. So when you're looking at this, do you see that 1 off to the side? You guys see that? That means that on the checklist, that is a graded checkpoint. You've got to get that done to get a graded checkpoint. Okay? Make sense? Okay. If you look down through every single step, almost all of them have those numbers. If it doesn't have a number next to it, it's an explanation on how to do a different numbered step. So if you take this and perform the skill exactly as it's written, you'll not only pass the test, you will get 100%. 100%. So those of you who haven't registered for the test yet because you're a little unsure, a little scared, a little nervous, you have the test right here. This tells you exactly what they're looking for. You also have the videos that show you exactly what they're looking for. And we just went through all the principles that tell you how to do these steps. So you have all the tools you need. All you've got to do is put these into practice. Now, if you're a little concerned about, well, I don't know the steps, I don't know the order, I'm a little unsure of myself, go into the online course and do the sequencing activities. You learn the steps and you learn the order those steps need to be done in. All of this is available for you to be able to pass that test. And then there's questions in there. If you can answer those questions, you know that you got the information you need to be successful. Okay? All right. The hip is a 2-for-1 exercise. That's why we do this. We don't do this one first because it gets a little confusing for students. You guys remember when we did range of motion on the shoulder? Right? We went up and down 3 times, and then we went out to the side 3 times because it told us to do flexion, extension, and it told us to do abduction, adduction. The problem with the hip, now all we're doing is flexion, extension, but the problem with the hip is if we just lift the leg straight up like we did with the arm. You know, the arm stays straight and goes straight up. We can do that on a shoulder. But if we try to do that on the leg, there's a problem. So we don't lift the leg straight up because of something called sciatica. And I'm going to show you why in just a second. Instead, we're going to bend the knee at the same time that we bend the hip. Now, when we do that, we're actually exercising both of these. See how they both bend? Right? Remember bending? So this is flexion. Bending is flexion. So flexion, and then straightening it out is extension. So we're exercising the knee and the hip at the same time. One exercise, 2 joints. This is the only time that we do that, 2 joints with one exercise. Okay. This is why. You've got nerves that run down the back of your legs. Now, those nerves all connect to your spinal cord, and that connects to your brain. So we got a brain, spinal cord, and then branched off nerves. Do you see how big those nerves are? Pretty big. Those nerves are actually already pulled pretty tight. All right, there's no slack. Do you see any like slack there? Doesn't look like a spaghetti noodle. It's pulled pretty tight. When you lift the leg straight up, notice it's gonna stay stationary here. What we're doing is lifting this straight up, and that's gonna pull that nerve super tight. And that can set off a chain reaction where the patient has pain going down the back of their leg and up into their back. It's called sciatica. And that may take 3 or 4 days to calm down after one exercise. So we never lift the leg straight up. We don't do this unless the care plan specifically tells you to. And I don't think you'll ever have that. So we're going to lift the hip and knee at the same time, bending both and then bringing them back to the bed. That's hip and knee. And heel or ankle, we're going to lift the foot off of the bed so that heel doesn't scrape against the sheets. We're going to lift the leg, supporting at the ankle, and then we're just going to bend the foot forward and backward. That's the skill. So knee to chest like they're walking upstairs 3 times. Lift the leg off the bed, foot forward and back like stepping on a gas pedal 3 times. It's the whole skill. Put an opening in front of it, put a closing behind it, and you've got the entire skill. This skill, you have 4 minutes to complete this skill. You can do it in about 2. Okay. Good? Good. All right. So I'm going to, I don't know if I can get, let me see if I can. Let me get somebody over here in the bed for me. Anybody? Okay. All right. And for the sake of time today, because I do want to give you guys some practice time, I'm going to simulate hand washing like the test tells me I can after my first skill. Okay. Oh, yeah, that'll work. Okay. Here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do some exercises on your right leg. Is that okay? Okay, I'm going to close your curtain. Oops. Maybe. Let me go wash my hands, get my supplies, and I'll be right back. I have clean hands. Now, if I wasn't 100% sure of which leg the care plan told me to do, I could go back and look at that care plan at any time to verify which leg, how many repetitions, or which exercise. You can stop the skill at any time to review that care plan. Okay. All right, Ms. Jones, I'm going to do all of the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay? First thing I'm going to do is lift your leg and bend your knee to your chest and back down to the bed. We'll do this 3 times, but let me know if there's any pain. Now, I'm short. I don't have to bend a whole lot to do this. Some of you are taller. You may want to raise the bed to a comfortable working height to do the skill so you don't have to bend, and that's okay. But don't forget to lower it at the end of the test. All right, so one hand under the knee, one hand under the heel. We're going to bend the knee up and all the way back down to the bed. Feel okay? Up, all the way back down. Feel all right? One more. Up, all the way back down. Good? All right, so now I'm going to lift your leg up off the bed just a little bit. We're going to push your foot forward like you're stepping on the gas pedal and then back towards your head. You should feel a little stretch. So I'm going to lift from below, forward, and back. Feel that stretch? Feel okay? Forward and back. That's 2. Forward and back. Good? Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Okay, bed is in the low position. She's in the middle of the bed. The environment is clean. Here's your call light. If you need anything at all, please press that red button. Open the curtain. Wash my hands. I don't have to document this one, so I'll think about my steps, make any corrections, and then tell the evaluator my skill is done. Thank you. All right. Any questions on that? Any questions? So this is what we did. We provided range of motion exercises to the right hip, knee, and ankle, flexion, extension. That was that up, down. We did 3 repetitions of each exercise. The resident was not able to help with the exercises. And these are the things that we need to know to be successful on the state exam. It's not doing what it's supposed to. There we go. Oh, let me see here. Okay, so now we're going to move on to performing mouth care to a resident with dentures. This is on page 96. All right, so let me explain to you a little bit about dentures. Some of you are familiar with dentures. Most of you won't be. So we're going to go over a few things with dentures. If you look here on this page, all of the principles that are involved in this skill are spelled out here. You can see that we have to follow the care plan. We're going to do our opening. We evaluate if we need gloves. We're going to use a barrier. Linen rolls apply. We're going to clean our basin, and we're going to do the closing. This is, at the bottom of the skill, test-specific information. This skill, you have up to 13 minutes to perform. 13 minutes. So this makes this a longer skill. Okay, remember range of motion was 4. Super easy. This is a longer skill, so 13 minutes. But if you look at the next area right there, it says a live testing student is who you're going to perform this on. And I don't know about you, but you probably don't have dentures. And you don't need to go get any before you go test. So in order to understand how this works, we have to go through a few things, a few principles about dentures that you may not be aware of. So let's get into that. All right, if you look at the top of the page, this is our skill step page, 97. You can see all the supplies at the bottom. There's a lot of supplies for this. You do have to learn it. We look at the care plan at the top of the page. It says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. Does not say they're in their mouth. So you can be a patient for this. Where are the dentures? In the cup. The resident's denture needs to be brushed with toothpaste, and the resident needs mouth care. The denture is stored in a denture cup after cleaning. Are we putting it in their mouth? No, it's where does it tell us to put it? In the cup. The resident is not able to provide their own mouth or denture care. So this is why you can be a patient for this. Because nobody's taking dentures out of your mouth. Nobody's putting dentures into your mouth. And in fact, CNAs aren't allowed to do that in clinical settings. You are not allowed to take dentures out, and you are not allowed to put dentures in. If patients can't do that on their own, we don't give them their dentures. We just puree their food. And the reason for that is safety. If I have dentures in and I want to take dentures out, let's say on the bottom, in order for me to take my dentures out, I got to put my fingers way, way back here at the very back of my gum line, like way back here. And I have to pop them up and forward. Okay. Now, if I'm doing that, I actually have the right leverage if it's my own fingers in there to do that. But if I put my fingers in somebody else's mouth, these joints right here have to press down for my fingertips to press up. Now, when you press down on that lower jaw, you aren't aware of how much pressure you're actually putting there, and you can easily dislocate a patient's jaw by trying to remove their dentures. Remember, dentures are usually stuck in with sticky denture paste. So it takes a fair amount of pressure to get them to pop up. And if you put too much downward pressure, you can dislocate their jaw. So we don't take dentures out. We also don't put them in. Again, safety, but this time it's your safety I'm concerned about. When a patient puts dentures in, they have to bite down to seat them. It's the only way to get dentures in the right place. Well, if you've got your hands in that mouth putting the dentures there and they subconsciously just bite down, they're going to bite your finger. And they're not going to know how much pressure because those teeth are not seated yet. And you can get really injured by trying to put dentures into somebody's mouth. So you don't take dentures out. You don't put dentures in. We just clean them. That's it. Okay. But it's not just the dentures we have to clean. We also have to clean the mouth those dentures came out of. Can you imagine how icky that mouth is going to get with denture paste and food particles if nobody's cleaning it? I was a hospice nurse for a long time. One of the worst cases I ever saw. This was horrible. This woman, she was in her late 80s, 90s. I don't know the exact age. Dementia patient. And the assisted living facility didn't have rules and regulations in place. And the CNA or the resident aides were taking dentures out and putting dentures in on a dementia patient. So when the resident aides were taking the dentures out, they weren't doing mouth care. They were just cleaning the dentures. They weren't addressing the mouth those dentures came out of at all, just cleaning the dentures. And because she was a dementia patient and nonverbal, all of that denture paste and food particles got stuck right up here in this pocket. And food decays. And that food decayed and ate into her gum, up into her sinus. And it's just a hop, skip, and a jump to the brain. It also ate through her cheek. And that's when they noticed it. She had this big pustule there that they couldn't get healed, and they didn't know what it was. They thought maybe she had gotten bitten by a spider or something like that. And it took them a long time to get to the bottom of what happened. Well, by then, the abscess was up into her brain. And that's actually what killed her. So what killed her was the fact that nobody did mouth care. Isn't that horrible? This is basic body maintenance. Any 4-year-old can tell you have to brush your teeth. So we've got to be careful not to assume that just because they have dentures, it doesn't mean we don't have to clean their mouth. Okay, good? Sad. It's horrible. So we can be a patient for this because the dentures are going to be in a cup when we start. They'll be in a cup at the end, and we're going to be sitting in a chair as the skill is being performed. Now, I want to talk to you about supplies down here. So CNAs clean both dentures and mouths, and we have some supplies that we're going to use. Now, we're going to do mouth care as part of denture care, mouth care. And instead of using a toothbrush, we're going to use something very specific called a toothette. This is a soft, spongy, basically toothbrush, but the biggest thing that helps us with mouth care with dentures is it's solid. It's spongy, but it's still a solid surface. Because remember, it's denture paste we're trying to get off the gums. And if you try to get denture paste off with a brush, that paste is going to get all tangled up in those bristles, and it's not going to be very effective. By using this, you can swipe that denture paste away, turn it, swipe again and turn it, swipe again and turn it. You've got 4 unique sides that aren't going to get all tangled up and useless. Okay. So there's 3 different types of dentures, and a lot of students aren't really aware of this. So I want to go over this with you. Don't touch dentures without gloves. So anytime you touch dentures, you need to have gloves. You can touch the cups without gloves, but anytime you touch dentures, you need gloves on. So let me grab some gloves. So the first kind of denture is the one that we're all familiar with. When I say dentures, this is what you guys think of. They're called full plates. So this is what we think of when I say dentures. It replaces all of the patient's teeth and it fits over their gums. This is what most people think of when we talk about dentures. Now, this is a top plate, and I know it because it's got a palate. Okay, this part that fits up against the roof of the mouth. We don't have this on the bottom because you have to have a place for your tongue. So bottom will be more of a horseshoe shaped. Okay, but this is a full plate. But if the patient still has some healthy teeth, we don't pull healthy teeth. If the patient still has some healthy teeth, they won't have a full plate. They will have something like this. This is a bottom plate, but do you see how it's got holes cut out? Those holes will fit around the patient's natural teeth that still remain. This is called a partial. Now, a partial usually has some sort of a ring or clip or something to attach it to teeth that are still there to help hold it in place. So full plate, partial. But then we also have another type of denture down here called a bridge. Now, a lot of times now, bridges are being permanently implanted. But in our older population, you'll still see removable bridges. A bridge is just a small piece of denture that's designed to replace one or two teeth in a very specific area. Okay, so 3 different types of dentures. You probably don't have dentures at home to practice on. Some of you do. It's almost Halloween time, so, you know, Spirit of Halloween can help you out with that, vampire teeth. But in our practice kit, we actually have pretend dentures for you guys to practice with. They have a groove on the back that would fit over gums. So this allows you to practice doing denture care with something that's very, very similar to a actual denture, so you can kind of get the feel of how this works. All right. So your patient's going to be sitting in a chair at the bedside. Their dentures are in a cup on the bedside table when we start the skill. We're going to take the dentures over to the sink. We're going to leave them there while we wash our hands and get our supplies. We'll get everything ready, take it over to the sink to clean the dentures. Remember, I can touch a denture cup without gloves, but I need gloves on to touch the actual dentures. All right. This skill actually requires 2 sets of gloves. We're going to need 1 set to clean the dentures. But once you've cleaned those dentures, you've got food particles and denture paste and all kinds of ick on your hands. Would you want those gloves in your mouth? Your patient doesn't either. So after you've cleaned the dentures, we're going to change out our gloves so we have clean gloves to clean the patient's mouth. There are 2 ways to clean dentures. There's toothpaste and toothbrush, which is what you're used to. And then there's fizzy tablets, which are what the people that make the dentures usually recommend. How you clean the dentures will depend entirely on that care plan. Now, if you remember, we read the care plan a few minutes ago, and it told us to clean the dentures with toothpaste. So that's what we'll do. But toothpaste is abrasive. It has little particles in designed to scrub your teeth. And those little particles, the abrasiveness of toothpaste, will actually gouge and cause micro cracks in the denture material. So most people that make dentures don't recommend that we scrub them with toothpaste. They actually recommend that we put them in a cup of water with those fizzy tablets and then just use a soft brush to brush off any remaining particles that might be there. We will follow our care plan for instructions. When we're brushing the denture, we're going to use a very specific type of brush. This is called a denture brush. This part looks like a toothbrush. That's what we're going to use on the teeth part of the dentures. This part's narrower. The narrower end fits into that channel or groove very nicely. It's chiseled into a point specifically for this purpose. So the chiseled point will clean the groove. The brush part will clean the teeth part. Good. This is not disposable. It's a toothbrush. We rinse it out and reuse it. This is disposable. We use it once and we throw it away. So this is what a tooth that is. I'm going to pass this around. This is what a tooth that is. It's soft and spongy. It's also called an oral swab, but it's going to clean the gums and the teeth because it's a solid surface. So take a look at those and then pass them around. We're going to use it just like a regular toothpaste. We'll wet it, we'll apply toothpaste, and then we'll brush all surfaces. We want to prepare that denture brush before we go to the sink or put on our gloves. Remember, the first thing the gloves should touch is the patient, or in this case, the dentures. The basin, after we prepare that denture brush, the basin's just going to hold that brush. That's all it's doing. Because I can't put the denture brush on the side of the sink. That sink is not clean. I can't just set the denture brush on there. That's gross. So we're going to use the basin to hold that brush until we're ready to use it. Once we get over to the sink, so we're not going to put the denture brush on the side of the sink. Once we get over to the sink, we're going to put a washcloth in the bottom of the sink because those dentures are about to get really slippery. Once I get toothpaste on them, they've got food and saliva and all kinds of stuff. They're going to get really slippery. If those dentures should fall into the sink, they're likely to break. If I put a washcloth in the bottom of the sink, specifically over the drain, if I can get that washcloth over the drain, then it's going to let the water pool up and it'll provide a softer surface if those dentures should fall. They're less likely to break. So we're going to put a washcloth in the bottom of the sink. We're going to turn our water on. It should feel cold, not hot. Do not use hot water to clean dentures. There's a principle in nursing, heat coagulates proteins. What that means is if you use hot water, it's going to make proteins harder to remove, stickier, harder to remove. We got lots of proteins in our mouth. Saliva is full of proteins. Food particles are full of proteins. The denture paste full of proteins. So you don't want to use hot water because it's going to make all those things harder to get off. So cold water is what we're looking for here. But we do need to use a paper towel to turn that faucet on because our hands are clean. All we've touched are clean supplies. And that faucet is not. So cool water. When we get the water running, the washcloth in the bottom of the sink and everything ready, then we'll put our gloves on, pick up our dentures, and then we're going to brush. We're going to brush whatever we see. The top, the bottom, the palate, all of it has to be brushed. Remember, you can handle the denture cup without gloves, but not the dentures. And the first thing those gloves should touch is the patient, or in this case, the dentures. So you brush all surfaces. Be careful that you don't drop the dentures into the sink. Don't set them down inside the sink. Keep them in your hand. Once you get those dentures cleaned and rinsed, then we have to have a place to put them. So we're going to take our denture cup, pour the water out. We're holding the denture. Pour the water out, rinse the cup, fill it up with cool water, put our clean denture in the clean cup filled with clean water. And then once we get that denture in the denture cup with water and we put the lid on it, we have to put it somewhere. And our care plan told us to put it on the bedside table for the patient to use later. So the care plan actually tells us. Okay. Is that what it says there? Read the end. What does the end of the care plan say? Store the dentures. Okay. The denture is stored in a denture cup after cleaning. So it doesn't tell us exactly where to put it, but you're going to put it on the bedside table. The problem is the table is like this. Okay. It's like a veneer. If I put remember my cup is wet. I've rinsed it out, filled it with water. My cup is wet. If I put a wet cup on a surface like this, what's going to happen? Yeah, it's going to warp the wood. That's going to trap moisture, and it can provide a breathing, warm, dark, moist area for pathogens. So what we want to do is put a paper towel underneath that denture cup to help absorb that moisture so we don't end up with a warm, dark, moist situation in our table. Remember, we use this table for everything. We're going to wring that washcloth out, place it in dirty linen. We'll bring the emesis basin and denture brush back before we remove our gloves. So we're going to bring everything back to the table before we remove our gloves. That's part one of denture care. Going to the sink, cleaning the dentures, getting them back in the cup, and ready for the patient to use. That's part one of denture care. So we're going to remove our gloves. Part one is done. Once we remove our gloves, then we're going to get ready for part two. We're going to put the towel over the patient's chest. We're going to wet our toothette. We're going to put toothpaste on both sides. We're going to set it in the emesis basin. We're going to get all ready for part two, which is the mouth care part. And once we're all ready, then we'll put on our gloves, because the first thing your gloves should touch is the patient. So then we're just going to perform mouth care. Brush all surfaces. Now, for the test, you're actually brushing teeth. But remember, your patient might have a partial in real life and have teeth. Those toothettes can do both teeth and gums. We'll leave the resident's mouth clean and dry. So we're going to perform mouth care. Just brush all surfaces, let them rinse and spit as often as they need to. Leave their mouth clean and dry. And then we'll clean up all of our supplies. Make sure the patient is comfortable and do our closing. So any questions on that? So in the practice kit, we actually have a denture cup, dentures, the simulator, these things, toothettes, and denture brushes for you to be able to practice with. So everything that you see in this video that I'm going to show you, everything that you have in here to practice, you have in that practice kit. This is what the kit looks like. Comes in a carrying bag. All right, so let's go ahead and watch the video for denture care.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with the paper towel to store the basin and other supplies. I'll remove the barrier from the table And we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. All right, any questions on denture care? What's that? Yep. So for the test, they will have a cup of water and a pitcher on the bedside table. So it's easy for you to get. Now, not all testing centers do that. They're supposed to, but not all do. In that case, when you go get your supplies, you can get water from the tap. There will be a cup there. You will get water from the tap, but make sure you use a paper towel to turn the faucet on. But most of the time they have, because not all testing centers have water that you can really drink out of the tap. So usually they'll have a pitcher of water or bottled water. Paper towel. Yeah. When your hands are clean, you can't touch faucet. All right. Any questions on that? Okay. So we're going to talk about ambulate with a gait belt now. And in order to understand, this is going to be kind of a longer lecture. So this is just walking. I mean, ambulate with a gait belt just means we're walking a patient. And we're going to use a gait belt to help lift them to a standing position and provide a little stability while we're walking. So this isn't a particularly hard skill, but there's a lot that I have to go over with you so that you understand why certain steps are important. So we're going to go over this together. First thing that we're going to talk about is energy conservation, which is what you see on the screen here. This is on page 63 in your book. Have you guys ever seen a 2-year-old? I love 2-year-olds. Oh my gosh, it's like my favorite age. They're so full of energy and the world is magical. I love 2-year-olds. But boy, do they have a lot of energy. 2-year-olds will jump up and down for no reason. They do not have to have a reason to jump up and down. They'll just bounce. When was the last time you jumped up and down for no reason? Now, if I win the lottery, I'm jumping. But anything short of that, probably not. We don't jump up and down as adults to burn off excess energy. In fact, we drink drinks like that to give us more energy. So what we have to understand is that our energy levels decline throughout our lifespan. And you peak at somewhere between 2 and 5. That is the most energy you will ever have in your life. And I'll prove it to you. Let's go out. Let's go out to 12, right? So 2-year-olds jumping up and down. Let's go out to 12. Now, 12-year-olds still have a ton of energy. They can skateboard and play basketball and video game all night. And, they have tons of energy. But you put that 12-year-old in charge of that 2-year-old for one afternoon, and who wins? 2-year-old. 12-year-old's going to be like, Mom, can't you make them take a nap? Right? That 2-year-old will absolutely win. And that tells us that our energy levels have declined from 2 to 12. Now let's go out to 22. Now 22-year-olds, they still have tons of energy. They can shop till they drop and go out at night looking fabulous. Okay? But you still don't have the same energy level you had when you were 12. Let's go out to 42. Now, 42-year-old, we're shopping till we drop, but that's at like 2, and I'm not going out. Now let's go out to 62. 62, we're thinking about retirement because there's just not enough energy to keep up with our daily household tasks and work full time. We're putting our feet up for 10 minutes before we make dinner because we need that rest period. So when we age, as we age, our energy levels are going to decrease. Now, what do you think the energy level is going to be when you're 82? Very little. Very little. So it's important for us to understand this because a lot of times as CNAs, you're going to go in and you're going to say, hey, Miss Mabel, I need to get you into the shower. Is that okay? And Miss Mabel's going to go, oh, no, honey, I don't have the energy for that. And you, in your mind, you're going to think, what do you mean you don't have the energy? I'm doing all the work. All you got to do is sit there. And I'm going to, what do you mean you don't have the energy? Have you ever tried to explain to a 2-year-old why you don't have the energy to do something they want you to do? Do they ever get it? Ever? No, they have no frame of reference. They think you're being lazy. They have no frame of reference. When we are working with older individuals and they try to explain to us why they don't have the energy for something, right? We're the 2-year-olds. We don't get it. We've never felt like that. We don't have a frame of reference. All we can do is react from our specific experience level. So it's important that you understand this. Your patient is not going to have the same energy level that you do. Well, why does that matter? Well, we have to think about all the things we do every day that take energy. Now, let's go back a second. If you've only got that much energy to get you through the day, that's it. That's all we've got. And we got to do all these things. What do you think is going to happen to our energy level at the end of the day? It's going to be gone. It's going to be gone, which means that the patient may not eat dinner tonight because they are out of, there's just none left. They're out of energy. What do you think that's going to do to tomorrow's energy levels if they're not eating? They're going to get lower. And this sets up a downward spiral that we call failure to thrive, but it's a downward spiral in your patients. So this is actually a very important topic, guys. This is way more important than most students give it credit for. If you have ever been too tired to fill in the blank, that means it takes energy. Have you ever been too tired to eat? I have. Have you ever been too tired to talk? Yeah, Mondays and Wednesdays, when I spend 4 hours in here talking nonstop, and then I go into the store and I run the store and I talk nonstop, by the time I get home, I'm out of words. I don't want to talk. I need some quiet time because I'm too tired to talk. Okay. Everything we do takes energy, but even things that you don't think about taking energy takes energy. Breathing takes energy. If you've ever had a really bad cold where it's really hard to breathe, you start to realize breathing takes energy. Showering and getting dressed takes energy. Digestion of food takes energy. So it's not just the obvious ones that you see up on the screen. There's other things that our body has to do on a daily basis that take energy. And if this is all the energy we have, and we got to do all this plus all the other things, we can run out of energy pretty quickly. So as CNAs, our job is going to be to find ways to help our patient conserve energy. So this might mean, do I have any morning people here? You function pretty good in the morning? Yeah. If you're a morning person, trying to give you a shower at night, probably not going to be helpful because you're out of energy. If you're a night person, trying to shower you in the morning may not be helpful because you don't have, your energy level hasn't kicked in yet. So we need to learn our patients' habits, what makes up their routines. And then we need to help them wherever we can conserve energy so that they're able to maintain those routines. In a lot of cases, this is going to be very, very obvious with meal times. As we age, we talked about this last class, our stomach volume decreases, so we eat smaller meals. Our digestion slows down, so those meals take longer to digest. And because we're not up walking a whole lot, digestion isn't as efficient. So a lot of times with our older individuals, they will eat bigger meals earlier in the day and small meals in the evening. So we may have to adjust how we feed our patients. Okay? These are all things that you may not be aware of because you're way up on the energy scale. So I've got to make you aware of them. Good. All right, so this is Ambulate with a Gait Belt. These are all the principles involved. And if you look at this, you'll see that shoe rules is something that we've touched on a little bit when we talked about foot care, but we're going to get into much more in this lesson. So this is our final principle. This is the last one we have to learn, and then we've got everything on that back wall covered. Wasn't too hard, was it? All right, so if you look at page 67, is it 67? Yeah. It goes through step-by-step instructions along with care plan at the top of the page. Our care plan says to ambulate a resident at least 10 steps, use a gait belt. Patient can stand and walk with assistance. So at the bottom of the page, you'll see your supplies. This is easy. All you need is a gait belt and shoes. And luckily for us, your patient's actually wearing shoes already. So we just have to say something about their shoes. All right, so let's learn a little bit about shoe rules. We know this one, slipper socks are not enough. We found that out with foot care, that they don't protect against injury and they don't protect against pathogens on the floor. Slipper socks are not enough. And when your patient's feet hit the floor, we have to talk about the shoes. But gait belts are something that we're going to learn how to use for this particular skill. Now, when we're talking about energy levels, right? Have you ever seen an old person try to get up out of a chair? Anybody ever seen an old person try to get up out of a chair? It usually looks something like this. Oh, no. How much energy did that take? Took a whole lot more energy than me just standing up, right? So remember, we only have this much energy. That's it. And if I'm using that much energy just to get up out of a chair, let's think about how many times we get out of a chair. Well, first we got to get out of bed. Then we got to get to the bathroom and sit ourselves down and get back up off the toilet. Then we have to go sit on the bed to get dressed. Then we have to get up and go to the dining room for breakfast, sit in a chair and get up. Then we have to go back to our room and wait until activity and then get up and go to the activity center. Do you see how many times we're going to get up out of that chair? If every one of them takes that amount of energy, I'm going to run out. So this skill is designed to teach you how to use a gait belt to help our patients stand easily. So instead of doing the whole rocking thing and multiple attempts, your patient can simply stand. And that helps conserve their energy for other tasks during the day. So that's what we're going to learn how to do with this skill. This is all about energy conservation. So this is a gait belt. A gait belt is a flat canvas belt, flat canvas belt, has a free end, and it has an end with a buckle. It does not matter whether the belt goes this way or this way. Nobody cares. What matters is that the tag is on the inside, like every other article of clothing. You're going to put this around the patient's waist, not yours. This goes around the patient's waist. And when you put this around the patient's waist, you want to put it on so that it's not twisted. Okay? So when we put this on, it's got to be flat like this, not twisted over. So we're going to put this around the patient's waist. I'm going to show you on me, but this goes around the patient's waist. The free end goes through the first guard by the alligator teeth. So we put it in, oops, just like that. And then we pull it the direction the teeth are pointing. See how all those teeth are pointing that way? We're going to pull it in that direction. If I try to pull it this way, it doesn't go anywhere. I'm going to pull it this way. And I want it snug. I only need to fit 4 fingers between the belt and the patient. If we have it too loose, if we put it on like this, when I go to lift the patient up, it's going to go up underneath their breasts or under their arms, or they'll slip right out of it. We need it snug so it stays in position. We check it with 4 fingers. Once you get it snug enough, you put it through the second guard to lock it in. Now this tail hanging down, if it's in your way, if it's super long, just tuck it up. And now we have a way of lifting our patient and supporting their weight to help them stand without doing all that rocking stuff. There is an inverse relationship. Oh, let me show you. There's an inverse relationship between strength and effort. The stronger you are, the less effort it takes. The weaker you are, the more effort it takes. So as our patients age and gets weaker, it takes more effort, but they're out of energy. And this can set up a downward spiral that we want to avoid. To remove a gait belt, we're going to take the free end out of the second guard, and we're going to hold it. We're going to take the buckle and slide it along the free end to remove it. When you take the gait belt off, we don't slide it against the skin. Listen closely to this sound. You hear that? That sound is going to leave a burn against the patient's skin. So we don't do that. We either loop it over, keeping hold of the buckle so it doesn't smack them in the head, or you can reach your hands around the back to remove the gait belt, but never slide it against their skin. Okay. Any questions on gait belts? All right. So when we put the gait belt on, we're going to get it super snug. We're going to check it with 4 fingers. Just make sure we can only fit 4 fingers. And then we'll lock that free end in the second guard. Okay. Before you stand a patient up, their feet must be flat on the floor. Now, you guys at home may not be able to see this very well, but I'm short. And if I sit with my hips all the way back against the chair, my feet are not flat on the floor. I'm on my tiptoes. So if you try to stand me up and my toes are all that's touching the floor, I'm going to go forward and I'm probably going to fall. So before we stand a patient up, if we're going to lift somebody, we have to make sure that their feet are flat on the floor. To do that, you just ask them to scoot forward a little bit until their feet are flat on the floor. They should be a short distance apart. Do not ask your patient to put their feet together when you lift them. This is not how you stand. You don't bring your feet together to stand up. You have them about hip width apart. So get your patient's feet in a normal standing position before you lift them up. Okay, good. Then we're going to reach around and grab the gait belt either on the sides or in the back, depending on how big they are and how big our arms are. But we want to lift at the heaviest part of the patient. The heaviest part of the patient is right here. So we want to get in place to lift the patient up to a standing position. We're going to use our strength to minimize their effort. To do that, though, we have to have the right body mechanics. So if I'm standing right in front of somebody and I'm lifting them up toward me, there's a physics principle here. Every action has an equal and opposite reaction. So imagine me sitting there and there's somebody here in front of me. And as they lift me forward, they're going to go backwards. That's just body mechanics. So that means that their back is going to have to absorb all of that weight coming toward them and then stabilize both of us. Both of us. So the chances of back injury is very high. The chances of falling are very high. So we don't stand in front of somebody to lift them to a standing position. When we, I'll show you the position we're going to be in just a minute. When we go to lift somebody, we always count to 3 before we lift them. That makes them a partner. 1, 2, 3, and we both stand. That way, whatever they can do, they will. Remember, independence is important. So what we're going to do instead of standing right in front of them is stand at an oblique angle. So if I bring this chair forward just a little bit, those of you in the class can see this. There is a line in front of the chair, and there's a line on each side of the chair. Do this. Okay. So if I'm sitting here, there's a line. I know it's kind of hard to see with the glare. There's a line right in front of my feet, and there's a line on each side. And what that does is it puts me in a box. You can actually draw a box around me and this chair. And I'm going to use that box for body mechanics. Instead of standing in front of somebody, I'm going to stand on the side of them. One foot is going to go across their feet to keep their feet from coming out. The other foot goes parallel to the chair. So now when I'm going to lift the patient, I'm going to bend at the knees, not the waist. So I'm going to come down like this. I'm going to grab the back of the gait belt, and I'm going to 1, 2, 3, lift. And when I do that, it keeps them steady, but it doesn't pull me off balance. Okay, good. Questions? Okay, so their feet need to be flat on the floor. There we go. Their feet need to be flat on the floor. The gait belt needs to go around their waist, so we can fit 4 fingers only between the gait belt and the patient. The gait belt needs to be snug. We're going to stand at an oblique angle, hold the back of the gait belt, and on the count of 3, lift our patient to a standing position. And once we get them standing, we want them to stand there for a couple of seconds just to make sure they're not dizzy or weak or nauseous or anything like that. And we probably want to ask them, are you feeling okay? I want to know here. I don't want to know over there. Because if we get over there and the patient goes, ugh, I'm not feeling so good, I have no exit strategy. There's nowhere for me to go. Now, what a lot of CNAs will do is they'll try to rush the patient back to safety. Get that patient back in the chair as quick as you can. Your patient isn't tolerating a slow walk. What makes you think they're all of a sudden going to be able to sprint? You're not going to make it back to the chair, ever. Never. So the safest place for your patient is sitting on the floor. If you're sitting on the floor, you can't fall on the floor. So we're going to help our patient sit on the floor, and then we're going to get some help. Okay. So if your patient shows signs of decompensation while you're walking, this is a very good test question. Sit them on the floor and get help. Never rush them back to the chair. That's how accidents happen. And CNAs will say the same thing. The same thing. I don't know what happened. We were walking. Next thing I know, they're on the floor. Yeah, it's not what happened. Your patient gave you signals. They gave you signs that something was very wrong. They turned pale. They got sweaty. They started to sway a little bit. They put their hand out on the wall. They put their hand up to their head, or they put their hand on their stomach. They did not just walk along, I'm good, everything's fine. It doesn't happen like that. Your patients give you a million neon signs. It's up to you to pay attention. Now, when you're walking the patient, you should be slightly behind that patient, and you should have an underhand grip on that gait belt. So now you can feel when they start to get a little unsteady. You can see whether they're getting a little weak or slowing down. Your attention needs to be 100% on that patient, not on your cell phone, not on Snapchat or Insta, not on the TV at the end of the wall, not talking to a coworker. Your attention needs to be 100% on that patient, because the majority of falls occur while a caregiver is beside the patient. Not because they try to get out of bed on their own. Falls occur when we are there helping the patient and not paying attention. We can do better than that. Okay, good? Good. All right, so when we stand the patient up, we want to ask, are you dizzy? I want to know here. If they say, yeah, I'm not feeling so good, have a seat. We're not going anywhere. Let me go get a nurse. When we sit a patient down, so we've gone for our walk, we turned around, we came back, we're going to sit our patient down, they need to know that chair is behind them. The only way for them to know that chair is behind them is for them to feel it with the back of their legs. So you're going to bring the patient back up to the chair, and you're going to say, when we get to the chair, I need you to turn around so you can feel the back of the chair, or the chair with the back of your legs. So you're going to help them turn, and you're going to ask, can you feel the chair? Yes. Okay, on the count of 3, we're going to sit. 1, 2, 3. And you're going to use that same body mechanics. 1 foot in front of their feet, 1 foot beside, and you're going to help them sit. We always bend at the knees, not the waist. One other thing with this skill is the evaluators, if you get this skill, this is the only skill that they try to throw you a curveball. And I don't like it, but I understand why they do it. If you get this skill, they are absolutely going to put something in your path. Now, our care plan tells us to walk a patient 10 steps. That's 5 steps in one direction, 5 steps back. It's not the walking really that they're judging here. It's all this other stuff. So when you go take the test, they're going to give you an actual destination. They're going to say, walk to the desk and back. Walk to the bed and back. They're going to give you a destination, and they're going to put something like the overbed table in your path. So walk to the camera and back. So you're going to go through your opening, knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to take you for a walk. Is that okay? I'm going to go close your curtain, wash my hands, get my supplies. I'll be right back. So you wash your hands, you grab the gait belt, you come back. By the time you get all that stuff done, you're going to forget that's in your way. So look around. Always look at your path. Is there something in your way? Because if I've got to leave my patient to move that table, that's when a fall could happen. You have to remove obstacles before you stand a patient up. Is that good? Make sense? This is a curveball. It will happen, and you've got to make sure that you're prepared for it. So take a look around, because if you start to walk that patient and you have not cleared your path and you have to move the patient around an obstacle, it could cause you to fail. It's that important. So our shoe rules, if the patient's feet hit floor, we talk about their shoes. So I'm going to say, do your shoes fit well? Are they tied? Whatever. Slipper socks are not enough. We're going to use 4 fingers between the gait belt and the patient. The patient's feet must be flat on the floor, and we're going to count to 3 before we lift. After we lift, we're going to ask if they're dizzy or weak. We're going to take them for a walk, standing behind and slightly to one side, holding that gait belt. And then we're going to return them to the chair, making sure they back up and can feel the chair and helping them sit. And we're going to use proper body mechanics. Now, let's talk about the patient in all of this. So we're going to remove any obstacles before we stand the patient to walk. The gait belt goes over the patient's clothing. We're going to hold the gait belt around the back or sides to lift, not the front. And this is super important. The patient actually has a job to do here. When you go to lift a patient, their hands should be resting on your shoulders, not at their sides. Do you see what's happening here? When this person is lifting this patient, she's lifting the middle of the patient. That patient's shoulders are trailing behind. This is not good body mechanics. So when you are going to lift a patient, their hands need to be on your shoulders to move their entire body as a unit. I actually took this screenshot off of a video that is currently on YouTube as an instructional video. This is not the correct method. Please be careful about this. They're looking for it. Okay? We're going to let the patient lead. We're going to walk slightly behind and one side, holding that gait belt. And your focus should be where? On the patient. We want to monitor how they feel throughout the skill. We're going to ask, are you dizzy? How are you feeling? And then as we return them to the chair, we want to help them sit using that same body mechanics. Gently lower them. We're going to remove that gait belt, check to make sure they're properly seated, and then do our closing. Thank you very much, Ms. Jones. Now for the test, your chair is going to be right next to the bed. Okay, that way they can reach a call light. Chair is going to be right next to the bed. But in some testing centers, because everything is so tight as far as space, the rooms are small. In some testing centers, they may have the chair out a little ways away from the bed just to be able to move around effectively. In that case, just make sure the patient can reach the call light or put it directly in their hand, even better. So at the end of the skill, remember the patient has to be able to reach the call light. If you're sitting in this chair, you can't reach a call light over there. I would need to put it directly in their hand. Good. Any questions on that? No? This is a really easy skill as long as you understand everything we just talked about. The skill itself, super quick, super easy. All right. Okay, that's what I thought. All right, so let me get a volunteer, somebody to come sit in this chair, and I'll show you the skill. Again, I'm going to simulate hand washing for the sake of time. Thank you. All right, so go ahead and have a seat. Yep, yeah, go ahead and have a seat. So those of you who are joining from virtually, I'm going to be walking in this direction. You're not going to be able to see this whole walk. My classroom will. Make sure that you just watch the video to see this. But if I walk you to the camera and back, they're going to miss some things. The classroom will. So I'm going to move this in my path because that's what the evaluators are going to do. Okay. I'm going to simulate hand washing for this skill. I'll show you how quick this is. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you?
Good.
Good. Do you feel like going for a little walk?
Sure.
Okay. I'm just going to go close your curtain, wash my hands, get my supplies, and I'll be right back. I'm going to close the curtain. I'm washing my hands. And here's my gait belt. All right, Ms. Jones, do your shoes fit well?
Yeah.
Good. And are your feet flat on the floor?
They are.
Okay, I'm going to put this gait belt around your waist. This is going to help me lift you to a standing position and provide a little stability as we walk, okay? So I'm just going to slide this around your waist, making sure that it's not twisted over in the back. We're going to put it through the first guard, pull it so it's snug, check it with 4 fingers, put it through the second guard, and I'll just tuck that tail out of the way. All right, I'm going to ask you to put your hands on my shoulders. Give me just a second. And this is exactly what I was saying earlier. Remember how sometimes you get so caught up in your opening that you forget to look? I just realized I have an obstacle in my way. So before I stand her up, I'm going to go move that obstacle. So we're going to get that out of the way. All right, Ms. Jones, I'm going to have you put your hands on my shoulders in just a second. And then on the count of 3, we're going to stand up and we're going to wait a few seconds to make sure you're not dizzy, okay? So I'm going to put my foot in front, this foot beside. Go ahead and put your hands up here. And on the count of 3, we're going to stand. 1, 2, 3. Feel okay?
Yes.
Dizzy at all?
No.
Okay. So when you're ready, I'm going to have you turn and we're going to walk to that desk and you're going to walk at your pace. We'll walk slightly behind into one side. Dizzy at all?
No.
Okay, we'll go ahead and turn around and we'll return to the chair. Good? All right, so turn around and back up so your legs hit the chair. I'm going to help you sit. Put your hands up here for me. And on the count of 3, we're going to sit. 1, 2, 3. You feel that support?
Yes.
Okay. So I'm going to remove the gait belt. Go ahead and lift this arm up for me. There we go. Are you comfortable?
Yes.
Is there anything else I can do for you while I'm here?
No. Thank you.
Okay. Environment is clean. The patient is safe. She's in the chair. Her hips are in the right position. So there's the call. Whoop, let me get out of there. There's the call light. If you need anything at all, just let me know. I'm going to go open the curtain, wash my hands, and just let me know if you need anything. Now, notice she's not going to hold the call light the whole time if she's a real patient. I would have something there to lay the call light on. But for the test, it needs to be in or near the hand. So I'm going to wash my hands, think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Thank you. All right. Any questions? Any questions? No? All right. That's one of the easier skills that we have to learn. It doesn't take very long to do, but pay attention to this, the table. Before you stand that patient up, you've got to move the obstacle. So take a look around. And if you forget, if you get the patient standing and you start walking, you say, oh my gosh, there's a table there. Return the patient to the chair, help them sit, move the obstacle, and then stand them and start again. Okay? Don't ever leave the patient to move the obstacle. Good? Good. All right. Let's go ahead. Around 96. 97. We're going to go ahead and take our break. And when you come back, we're going to do the last skill for today, which is partial bed bath. Partial bed bath is the longest skill that we have to do. It's the longest skill. It takes about 19 minutes, and there's a lot I have to teach you before we learn how to do it. So go ahead and take your break.
Y The level is all the time in the morning.
You need to check with your nurse. That's a restraint. So you have to have an order. Okay?
When I take it, no right. But in the morning, all the time, relax. Is very the face, look at the yeah, because all the time she ate the child with the cell. Yeah.
Yeah, you need to check with your facility. I can't give you specific guidance because gait belts in a wheelchair, they're not supposed to be used. They're not, you're using it as a restraint without having permission,
Okay.
okay?
Yeah.
Comme na finito. Ambulation. Would you like to bet it? This is difficult. Ada ba medyo communication din dito. Kaya yun na diagnosis na pala siya. Ada ko natin yung ulo niya. Kung di mo kawan na. Kung bakal ko niya agad. Shubingnya aku boleh kamu jenuh. Mari suara lambat memang mati. No, kita boleh dia suka su malah, bawa dia na. Boleh. Manda bem assim, né? Quando ele vai mais assim. Assim, eu não sei se eu deveria ser de mesmo. Se eu não material dele, class, we're gonna work on the PS, you know. Mm-hmm. No, exilio. Tubuko muito na minha trabalho. Ele sabe. Esse não vai poder esse não pessoa. Isso aqui é verdade. Adeus facturação, adeus caminhar, vou escrever. Adeus facturação, adeus caminhar. Facturação. Oh, é bem lá um pouco, né? Logo aqui. Olha, dando na validação, eu vou escrever. Olha. Não. Julia Douglas. Pareceu a próxima cuidar sobre a área vamos a ver el plan y vamos tú sabes contando.
Or I just need a backstory. The backstory of the battery was 200 volt. Because the battery itself is 9.
Wow, I'm putting it in. I'm just
All right. Okay, and we're back from break. Miriam, yes, I did see your email. Miriam asked if I saw the email. Yes, I did. I just have not had a chance to respond. I'm about a couple days behind on my emails. All right, so the next skill we're going to do is partial bed bath. This is the longest skill we do. This is, you look down here, somebody with your level of experience should be able to do this skill in 19 minutes or less. This is a very long skill. It's not a hard skill, but it's long. And it's going to take me quite a while to go over everything with you because there's a lot of things that we have to discuss here. Okay. So a lot of learning to do before I can get to showing you how this is going to be done. All right. So if you look at partial bed bath, you can see we're going to use every single principle except for shoe rolls. All of them are part of this skill. Yes, you can use a Hoyer, but you have to be trained on the Hoyer at your facility. And mechanical lifts, Hoyer is just one brand of a lift. Mechanical lifts require 2 staff members to use. Now, a lot of people get really all caught up in that. The only reason you need 2 people is because when you are focused on the controllers, who's focused on the patient? And if something goes wrong, and these things do fail, I mean, straps break, chains get twisted, people get, body parts get caught, as this thing scissors up. If nobody's paying attention to the patient and you're paying attention to the controller, that's when things happen. And that's why we need 2 staff members. So one person is paying attention to the patient. The other person is paying attention to the controller. Make sense? Okay. So yes, you can use mechanical lifts as long as your facility allows it, right? It has to be in the policy and procedure. The care plan calls for it for that particular patient. You've been trained on the mechanical lift and your facility because they're all different. And you have 2 staff members. So that's a lot of caveats to mechanical lifts. Okay. Good. Good. Okay. And they all work a little bit differently. All right. So you can see all of the different principles involved here. We're using everything. So we follow the care plan. We do our opening. We decide if we need gloves. Spoiler alert, you do. We're going to use a barrier. We're not going to hold the linens against our uniforms. We're not going to snap or shake the linens. We're going to use a privacy blanket. We're going to have to turn the patient on their side, so we'll scoot them toward us first and then turn them away. Whatever we wash, we rinse. Whatever we rinse, we dry. We check water. They check water. No soap in the basin. When you apply lotion, put it on, wipe off the excess. We're going to clean the basins the same way we clean everything, and then we'll finish this up with the closing. So a lot of steps here. Lot of steps. All right, short version up here. I do have a video for this. You can see test-specific information down here. This will be done on a mannequin during the test.
on a mannequin. So step-by-step instructions. Lots of supplies. Lot of supplies. No way around it. You have to learn your supplies. Because in a clinical setting, I'm not going to say, hey, Janiyah, right? I'm not going to say, hey, Janiyah, go give a partial bed bath, and you're going to need to take 2 towels, 4 washcloths, a basin, soap, lotion, a clean gown, a privacy blanket, a set of gloves. I'm not going to tell you that. I'm just going to say, hey, go give a partial bed bath. And I expect that you know what you need to do that task. So you have to learn your supplies. Flashcards will be a big help in that. So our care plan at the top of the page tells us to give the resident a partial bed bath and a back rub. Let's stop there for a second, time out. Let's talk about that back rub. We are not massage therapists. We did not go to school for massage therapy. We aren't deep tissuing anything. The whole purpose for this, there's 2, but the whole purpose for this back rub is, number 1, circulation. Because the patient's been laying on their back. Do you guys remember talking about the compression of blood vessels when you're laying on, a flat surface? So we want to open up those blood vessels. So a brief back rub will help with that. It's going to help stimulate circulation. The second reason is simply to make our patients feel pretty good. When you were little and you got sick, mom probably came along and just rubbed your back really lightly, and it always made you feel just a little bit better. And that's what we're doing here. We're helping with that human connection. Okay? So we have to understand why we're doing the back rub. We're not trying to deep tissue anything, right? This isn't a hot stone massage or anything like that. It is just three passes. So we're going to start at the base of the back, the lower back, go up in small circles to the shoulders, come down, go up again, come down, go up again, and come down. That's it. That's the whole back rub. Okay. It's enough to open up those blood vessels and restore circulation, but it also will make the patient feel just a little bit better. Anytime we put lotion on, we warm it up first, apply it in the back rub, and then wipe off that excess. Well, again, we're going to go by our care plan. So if the patient had, let's say, a decubitus ulcer on their back, the care plan probably would not ask you to do a back rub. Or it may say, provide a brief back rub above the level of the dressing. So we're going to, the nurse's part of this is to specify the actions that we need to take specific to that patient and their needs. Every care plan should be customized. Now, let me take a time out on that real quick. And I probably shouldn't be telling you guys this. A lot of facilities have moved to what we call canned care plans. So these are very non-specific, one-size-fits-all, computer-generated, generic care plans based on certain disease processes or procedures or that type of thing. They're not specific to the patient. Because in a lot of cases, the nurses just don't have time to do a good care plan. I am not in favor of this by any means at all. And I am more along the lines of vehemently opposed to this for 2 reasons. Number 1, no computer in the world can write a care plan specific to this patient that is going to take into account everything that's going on with that patient. That is a nursing modality. That is the one thing that makes a nurse a nurse. It's not giving medications. It's not doing treatments. It's not hanging IVs. That's not what makes a nurse a nurse. A nurse puts all of those pieces together and develops the plan. Well, if we're outsourcing that to a computer, then what is the point of having a nurse? So I think it diminishes the role of nursing, and I don't like it. But the second problem is that you as a CNA have to rely on care plans to know what to do with that patient. And if the care plan is generic, you're going to be left with a whole lot of questions. So let's say a patient does have a decubitus ulcer and our facility uses generic care plans, and there's nothing on that care plan other than give the patient a bed, bath, and partial and a back rub, right? And you're like, but they've got a dressing there. What do I do? What, I mean, it's not in the care plan. What do I do? That's why I keep saying over and over and over, we only have two choices. We follow the care plan or, right, report it to the nurse. So in that situation, you would go to the nurse and say, hey, you want me to give a back rub based on the care plan, but there's a wound there. What do you want me to do? And when we start doing that, they'll make better care plans because they're going to get tired of being interrupted all the time. Do you guys see that? Be very, very, very careful about deciding on your own what you're going to do. Because remember, if it's not on the care plan and you do it, who's liable? No, the nurse is not. We are. Okay, so be very careful about that. So that's kind of my soapbox issue. I don't like canned care plans. I think they diminish the role of nursing completely. I understand that nurses are overworked. I understand that, but that's an administration problem. That's not a nursing problem. And I think that as long as nurses allow that to happen, we're not going to have the health care that we deserve. Okay. So those of you who go on for nursing, make sure you're reviewing your care plans because the rest of the team relies on them. All right. I was really happy to see, just on a side note, right, our program, our books and our program are used by schools all over the country. Well, the largest nursing school just contacted me about 2 weeks ago. They're going to start using our books and our programs in the first semester of the nursing program to teach the nurses how important care plans are. And I think that that's a great step toward improving our healthcare system. So I'm really, really happy about that. All right. So our care plan says, give the resident a partial bed bath and back rub, wash the resident's face, neck, chest, abdomen, back, and one arm and hand with soap and water. So it tells us exactly what to wash. I'm going to shorten that for you, face to waist. One arm and hand, front and back. Okay, face to waist, front and back. All right. It tells us to provide a brief back rub with lotion, dress the resident in a clean hospital gown after bathing. Well, that just makes sense. When we get out of the shower, we put on clean clothes. That makes sense. And the patient is lying on their back in the center of the bed and can roll as directed. So we don't have to do the up, over, bent, angled. We don't have to do that. We just ask them to scoot toward us and turn. And but they're too weak to assist with bathing. Remember, if your patient can bathe yourself, you're not in there. You're not doing it. People do not want to be bathed if they're able to bathe themselves. That's just a huge invasion of privacy and humiliating and making somebody dependent. So if the patient can bathe themselves, we're going to give them water, washcloths, soap, towels, whatever they need. Let them do what they need to do. And then we will go back and help with whatever they need help with. Okay, good. No. Yeah, if they can bathe themselves, absolutely. Here's the stuff. Let me know when you're done. Yeah, I don't need to be in the room. Remember, this isn't a child. This is an adult. So let me give you an example. Let's say that you broke both of your legs, right? You go outside, you slip on something, you break both of your legs, and now you're in the hospital. Well, your arms still work. You can still wash your face. You can still wash your upper body. You just can't get to your feet, right? You can probably even still wash your private areas. Would you want a stranger standing there making sure that you get it done right? No, you're an adult. You're not going to want some stranger monitoring you cleaning your own body. I'm X number of years old. I've been doing it for a long time on my own. I think I got this down, right? But you would want somebody that can come in and get the areas that you could not reach. If you broke both of your legs, that means, somebody's got to clean your toes off for you on the other end of the cast because you can't reach it. Make sense? So we've got to be really careful not to treat those adults like children. All right. So now that we know what to do, we've got to learn one final thing in order to put all of the pieces together to do this skill. Remember, we're going to use all of these principles. Well, there was one that we missed with washing rolls, and I told you we were going to come back to it. So this is the very, very, very last thing that we have to learn. Okay. So we're going to learn this missing piece. So we know basins are no soap zones. We've learned that. We know we have to use a paper towel to turn the faucet on. We know that. We're going to use warm water, not hot, not cold, just warm. We're going to ask our patient to check it. Whatever we wash, we rinse. Whatever we rinse, we dry. We're going to try to keep our surface dry as well. So we'll put a towel on the bed. And we're going to warm lotion before we put it on and wipe off the excess. We know all that. So what are we missing? This piece right here. So this is what we're missing. Use the leaves method for body openings. Now, what is the leaves method? What is that? So let me explain to you what that is. So 1, 2, 3. Those of you who are playing along at home, 7, 8. Those of you who are playing along at home, go get a washcloth, just a plain square washcloth, so that you can play along here as well. So can you take one and then just pass them around? So everybody has a washcloth. I just gave my class washcloth. Okay. So those of you at home, go ahead and grab a washcloth so that you can play along. Keep that washcloth there. Let me review these principles. So we don't add soap to the basin. We have to keep our water clean for rinsing. We're going to use a paper towel to turn the water on. We're going to check the water. Should feel warm. Patient's going to check it too. We're going to change it if it gets cold or soapy. Whatever we wash, we rinse. Whatever we rinse, we dry. And dry surfaces should remain dry. So we'll put a towel on the bed and a barrier on the table. Lotion is warmed up, then wiped off. So this is what we need to learn here is the leaves method. So if we have a plain washcloth, normally we fold it in half and then in half again to make a small square. So this is what all of you guys have in front of you, right? A small square, fold it over. And we tend to look at it as a square. But squares are kind of unique because they don't always have to be squares. They can actually be diamonds. So if we turn it a little bit to make a diamond shape, and with the diamond, you want the free edges, the corners at the very top of your diamond. So the corners at the very top of your diamond. Okay. And then you're going to put it in your dominant hand, just like that, with the corners facing up. You're going to use your thumb to hold one side in and your pinky to hold the other side in. So you now have something that looks like this. Okay. This allows us to wipe something, fold that over and trap the contamination underneath and give us a new cleaning surface to work with. We can then wipe something else, fold that over, giving us a new cleaning surface. We can wipe something else and fold that over, giving us a new cleaning surface. And if we had to, we can even fold that over and use the backside as a cleaning surface. So this is called the leaves method because this allows us 5 independent leaves that we can fold over to prevent cross-contamination. So we call this the leaves method. And that's what we need to learn. So the leaves method is going to be used anytime we're washing a wet body opening. Now, we've talked about wet body openings when we talked about the chain of infection. Remember, a wet body opening is any break in the skin that can let pathogens out or let pathogens in. So this would be the eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions. Okay? Wet body openings. We would use the leaves method if we're going to wash any of these areas because if I wash the eye, I now have eye boogies on there. I don't want to take those eye boogies onto the other eye. I need a new leaf. If I'm going to wash around a wound, I don't want wound drainage to be transferred somewhere else in the body. We want to use a new area of the washcloth. Make sense? Okay. All right, so to review, you take your washcloth, fold it in half and in half again, make sure the corners are at the top and put it in your hand. You want to put this in your dominant hand, so if you're right-handed, put it in your right hand. If you're left-handed, put it in your left hand, and you want to tuck it in. When you tuck it in, your thumb should hold one corner down, and your pinky should hold the other corner down. Then you can wipe whatever it is that needs to be wiped. Wipe, fold, wipe, fold, wipe, fold, wipe, fold, and wipe if you need to. So 5 independent cleaning surfaces here. Good? So when we're doing partial bed bath, remember it's face to waist, front and back. One arm in hand. This is just like hand and nail care. They don't need to see you do it on both sides. They want to be home in their pool drinking their margaritas, right? So they're only going to have you wash, rinse, and dry one arm. They don't need you to go to the other side and do it. They know you got it. In a clinical setting, if your patient has a wound, a rash, an incision, a cast, anything like that, you're not going to do that other arm. So we follow the care plan. So let's look at the care plan one more time. We're going to give the resident a partial bed bath and back rub. We'll wash the resident's face, neck, chest, abdomen, back, one arm and hand with soap and water. Provide a brief back rub with lotion. Dress the resident in a hospital gown. Patient is lying on back in center of bed and can roll as directed, but is too weak to assist with bathing. So our steps that we have to follow for this particular skill, you can see there in the black principles. Face to waist, front and back, one arm. We're going to wash the face first. No soap on the face. Soap stings the eyes, dries out the skin of the face. No soap on the face, just water. So we'll use water. We're going to use the leaves method. Wipe an eye, fold it over, wipe the other eye, fold it over, wipe the skin, fold it over, wipe the nose last. I do noses last because, boogers, right? And then you're going to dry those areas. Now, face to waist. So now I'm going chin to waist. There's no open body areas there. So I can just use just the top part of the washcloth. There's no open, wet body openings. So just the washcloth. So wash the under the neck, behind the ears, the chest, abdomen, up the side, down the front of the arm, up the back of the arm. I do the armpit last because, I don't want armpit funk everywhere, right? Armpit last. And whatever I wash, I rinse. So I'm going to get a new washcloth, wring it out real well. No drippy wet washcloths. And I'll rinse behind the ear, under the chin, the neck, the chest, the tummy, down to the waist, up the side, down the front of the arm, under the back of the arm, and the armpit last. Now, the rinsing washcloth, I can reuse. I didn't put soap on it. So I can put it back in the basin to stay warm so I can wash the back. If you want to get an extra washcloth, you can. This can be done with 4 washcloths. If you want 5, give 5. Nobody cares. Nobody's counting. Except during the test, if you try to grab 10 or 12 washcloths to do a skill, they're going to tell you you don't need that many washcloths because you're not the only one they're testing that day. That's all the supplies we have for testing. That's it. Whatever's on that shelf, that's it. If you take 12 washcloths and you take 12 washcloths and you take 12 washcloths, by the time we get to you, there's no washcloths left. And how are you going to do your skill? So the evaluators will tell you don't need that many. In a clinical setting, supplies are always in short supply. Always. This is why I teach you how to do this with 4. Because in most cases, you're not going to have extra washcloths when you're out there in the clinical world. You've got to know how to do this with as little supplies as possible. But for the test, if you want to use 5, use 5. Doesn't matter. So we're going to control the washcloth when we're cleaning. No what we call floppy corners. So I don't want to hold this, and floppy corners everywhere. I want control over this because we don't want those corners to hit the patient or, make them uncomfortable in any way. Anytime we lift an arm, we always support it from below. We're going to wash, rinse, and dry. Turn them on their side to wash, rinse, and dry the back. Give them a little back rub and clean gown. So easy. This is an easy skill. So face first, no soap. We're going to wash the eyes. Let me come over here. So I'm going to take my washcloth, fold it in the leaves method, tuck my corners. No soap, just water. Wrung it out real good. No drippy wet washcloths. And I'm going to wipe inner to outer corner on that eye, fold that over. Inner to outer corner on that eye, fold that over. I'm going to wash the face, fold that over, and then wash the nose last. And I'll put that aside on the barrier. I'm done with it. That's got eye boogies, mouth stuff, nose stuff. I'm not using that anywhere else. And then I'm going to dry that face. We're going to dry that face. So we use leaves method on wet body openings like eyes, nose, mouth. We're going to wring our washcloths out thoroughly so they're not drippy wet. And then I'm going to wash the body. So I'll get a washcloth, wring it out, put soap on the first leaf of the washcloth. That's all I need. I'm going to wash the under the neck, behind the ears, chest, up the side, down one arm, hand, up the back of the arm, armpit. They give you 19 minutes to do this skill. I can do this entire skill, opening, supplies, skill, cleanup, closing, the whole thing in about 8. But you got to practice it to get fast. Okay, good. So after we wash, we'll set the washcloth aside on the barrier. We're not going to return anything that we apply soap to or that has touched a wet body opening to the basin. After we've washed, rinsed, and dried the front of the body, we're going to scoot our patient toward us, turn them on their side, and I'm going to wash, rinse, and dry the back. Easy. Easy. No body openings here, so just soap on a washcloth, wash, rinse, dry. No drippy wet washcloths. We're going to give them a brief back rub with lotion for circulation and comfort. We'll warm the lotion up first, and then we'll wipe it off after. Let's talk about that gown for a second. This messes students up all the time. Nobody cares when you change the gown. Nobody cares. It's not a graded checkpoint. Nobody cares. So, and a lot of people out there will tell you, well, you have to do it now. You got to do it. Nobody cares. It's not a graded checkpoint. As long as the patient ends up in a clean gown at the end of the skill, you're good. Okay. But let me explain to you why it actually does matter in a clinical setting. Do you guys remember we just talked about energy conservation? You guys remember that? Right? So we only have this much energy when we're older. This is it. And if your patient's bedbound, they have even less. Even less. because constantly, if they're bed bound, then they're not strengthening anything. So they're going to get weaker and weaker and weaker, which is going to affect their energy levels. This is a bad thing. This is why we don't like people in bed. We want them out. So we've got a patient that's in bed and we're doing a partial bed bath. Energy conservation is going to be important here. If you take the gown off, wash, rinse, and dry the front, turn them over, wash, rinse, and dry the back, turn them back on their back, put the gown on, turn them back on their side to tie the gown and back on their back, that's a whole lot of turning. That's energy your patient has to expend. There's a better way to conserve energy. Remember, energy conservation is important. So when I'm working on the front of the patient, I take the gown off, I wash, rinse, and dry the front, I put the gown on the front. When I turn the patient over, I wash, rinse, and dry the back, the gown is already on. So when I'm done with the back rub, I just tie the gown. And the patient only has to turn once. Energy conservation. It also is time conservation. Okay, good? Make sense? When we are putting the gown on, make sure that you're supporting the arm at the elbow. We lift from below. So we're going to do our opening. We're going to wash our hands. We're going to get our barrier. We'll put our supplies on the barrier. We're going to fill the basin using a paper towel, check the water temperature, have them check the water temperature. We're going to sit them forward to untie the gown and put a towel on the bed. Keep our sheets dry. And then once we get them laying back down, we'll put a privacy blanket over them and pull the sheet down so that they're covered and warm, but it still allows us to get to the areas that we need. We're going to put some gloves on because we're ready to start. First thing our gloves should touch is the patient. We're going to get our washcloth, wring it out, wipe the inner to outer corner, fold that over. The other eye, inner to outer corner, fold that over. Wash the rest of the face and the nose last. And then we'll dry all of those areas. See how I control the towel when I'm drying? And then we're going to wash, rinse, and dry the torso. We don't really care. You okay? Oh, no. Let me get that for you. Then we're going to wash, rinse, and dry the torso. You're fine. You're fine. There you go. Don't open it soon. All right. Wash, rinse, and dry the torso. Once we get the patient, and notice the towel stays under them. So we're keeping those sheets dry. Once we've washed, rinsed, and dried the front, we're going to take the old gown off and put the new gown on. And then we're going to scoot our patient toward us, roll them away from us, and now they're in a position to wash, rinse, and dry the back. After we've washed, rinsed, and dried the back, we'll warm up some lotion, give them a little back rub. After we do that, we'll wipe off the excess lotion and tie the gown. And we can take that towel away now because we don't need it. So after we take the towel away, the patient, let me go back here. The patient will be on the bed, on their back in the center of the bed, covered by the bath blanket. And we're going to go put all of our supplies away. The linens and the gown go in dirty linen. Remember, nothing goes on the floor. The basin gets clean and the supplies get put in the basin to be stored. Then we can remove the gloves and the privacy blanket and perform our closing. This does not take 19 minutes to do. But when you're first starting out, it will take you a long time because there's a lot of steps here. You will get faster the more you do it. So I want to talk to you about employment real quick. CNAs are in demand, right? You're not going to have a hard time finding a job. You're just not. CNAs are in demand. But they do expect a certain level of competency. And when you're brand new at anything, you're slow. You're not competent. You're still learning. And when you get out of this class, even though you're certified, you're still learning. You're still perfecting your craft. You're entry level, not mastery level. Your employer will see you more as an asset if you have practiced these skills to the point that you can perform them competently in a reasonable time frame. So let me explain to you what I mean. When you're out there and you get hired, you're probably going to have 12 to 15 patients, depending on the setting you're in, maybe even more if the patients don't require a lot of care. If it takes you 19 minutes to do a partial bed bath, let's just round that up to 20. Okay. That means you can only do 3 an hour. Now, that's not taking into account any toileting, grooming, dressing, feeding, nothing else. You can do 3 and that's just like, face to waist. That's not the whole body. That's face to waist. If you've got 12 patients and you can only do 3 an hour, that means half of your shift is just bathing face to waist. You're not going to be all that effective. You're not going to be very helpful to them. So the more experience that you have, the more you practice these skills, the more competent you'll be when you get out there in the workplace, and the more of an asset they will see you as. That means that your pay will reflect that. But if you go into a facility and you are super slow and you have no idea what you're doing and you've never done any of these skills, you just barely got through the test, but you got through it, and now you're a CNA, and you get in there and you start to work, and they have to work with you and work with you and work with you and work with you and work with you, and you're on orientation for 6 weeks because you're just not getting it, they're probably not going to see you as an asset. Make sense? So if you really want not just a job, but if you really want a good reputation in the industry, you've got to practice these skills. Make sense? Okay. All right. All right. So these are the steps, just to remind you. We're going to wash face to waist, front and back, one arm. Face first, no soap. We'll use the leaves method on the face and then dry. We'll control the washcloth during cleaning, no floppy corners. Support the arm at the elbow when lifting. We'll wash, rinse, and dry the torso, one arm and hand. We're going to turn them on their side, wash, rinse, and dry the back, brief back rub, and apply the clean gown. Those are the skill-specific steps that need to be completed here. All right, so let me show you this video. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves. Miss Jones, let me go get some water. I'll be right back.
Ms. Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown. And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Miss Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Ms. Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this leaf over to prevent contamination from spreading to the other eye. Ms. Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso, around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinse washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. Go ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Ms. Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Ms. Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, and we'll soap the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out, and we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please, and scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin, and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded, and now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done.
All right. Any questions on that? All right. Luckney says, hello, Miss Patty. I'm from Connecticut. Thank you for the videos, book, and online CNA test prep. I did my exam yesterday and passed. So congratulations. Great job. Oh, Tamika. Oh, no, I'm so sorry you got the flu. Oh, well, healing vibes out to you. I hope you feel better. All right. So tonight you have chapter 7 in homework. It's another skills chapter, so make sure you're reading the paragraphs in between. It's kind of an easier chapter. So you'll read chapter 7, take the test on page 130 or 187 in your skills book and grade it. I'm going to hand out your review sheets, and the rest of class will be practice. So I told you as we go through the program, you're going to get more and more practice time at the end of each class. So I was hoping for an hour. We're just a tiny bit off. Doing pretty good on time. Does anybody have any questions before I end today's session? Any questions? Remember, if you're not practicing here, make sure you're practicing somewhere. You need to be practicing. I can't force you to stay. It's adult education. The mannequins are here. The beds are here. The supplies are here. It's all here for you to use. But if you need to leave, you are welcome to do so. I will sign off of virtual because they don't need to see you practicing. All right. So if there's no further questions, we're going to go ahead and sign off of our live stream, and then I'll open it up for you guys to practice. So those of you who are on our live stream, remember the game show is next Tuesday, not tomorrow, a week from tomorrow. We have another session on Wednesday. That'll be the end of week 3, one more week to go. So we're nearing the end. Remember that you have all the resources that you need on flcnatraining.com, including the worksheets. You can download and use them yourself. So we'll see you next time. Until then, happy caregiving.